So every month, hundreds of people, sick and hurting, make a trip to the emergency room. Unfortunately, some of them are seen quickly, some others wait, and others just get sick and tired of waiting and never being seen.
And tonight we're on your side, investigating how Valley ERs stack up to the rest of the country when it comes to those wait times. And let's just say the numbers are not good. Reporter Chris Oswald has the answers in this On Your Side investigation.
Here we go.
What do we got coming in?
Some guy got hit by a car.
Fast-paced and unpredictable. It's the last place anyone wants to be, but for hundreds of people in the Treasure Valley, a trip to the emergency room is inevitable.
Patients that are most ill will get brought back first. Beyond that, we take them in the order that they come.
Many of those patients find themselves waiting. A 2009 report from the Government Accountability Office finds ER wait times continue to increase. Idaho is, of course, following that trend. A 140-page report by the American College of Emergency Physicians done just last year ranks Idaho among the bottom 10 states when it comes to access to emergency care, giving the state an F. The biggest reason for that? The lack of doctors in Idaho. According to the report, there are 9 ER physicians for every 100,000 people.
We have done a lot of improvement this year, and it hasn't been easy.
Dr. Eric Elliott is an emergency room physician at St. Alphonsus in Boise. At his hospital, a patient can expect to wait around 27 minutes before being seen by a doctor. That's right on par with the national average of 26 minutes.
We stack up very well, so we rank well both nationally and locally for our wait times.
While that may seem good, that's just the time it takes to be seen by an ER doc. In many cases, patients can expect to spend several hours in the ER. An admitted patient at St. Alphonsus can expect to wait nearly 7 hours before they are moved from the ER, the worst in the state according to reports. Nationally, that time is just over an hour and a half. There is likely a good reason for that wait, though. St. Al's is the only Level 2 trauma center in the region. Dr. Elliott says a patient's wait depends on their symptoms.
Which patients need to come back immediately, which patients need to see a physician immediately, and which patients can have things started but perhaps wait a bit to see the physician, in the meantime having care started with protocol.
Just a few miles away from St. Al's at St. Luke's, the hospital has similar wait times.
90% of the time, we're able to see patients within half an hour of when they first show up in the door.
A quick response to begin, but again, it can take upwards of 2 hours for a patient at St. Luke's to be discharged. If a patient is to be admitted, they can expect to wait in the ER nearly 6 hours before being moved to a room.
No, the majority are sent home, and then it's about 15% that requires extended stay in the hospital.
Not everyone is getting the medical attention they need when they arrive at the ER, though. ProPublica, a nonprofit investigative organization, finds 1% of all patients at St. Al's and St. Luke's leave the hospital before even being seen. That's not unusual, though, and is pretty much in line with the rest of the nation. Doctors at both St. Alphonsus and St. Luke's know quick care is key to saving lives and are working to make improvements to provide better care. Chris Oswald, Idaho on your side.
And doctors at both hospitals encourage patients to know their symptoms and be honest about them when they arrive in order to receive the best and fastest care possible. Now, you can check out how all Idaho hospitals rank in those wait times on our website, idahooonyourside.com.